Moderators, hope I'm audible. Esteemed participants, my fellow panelists, and the organizer of this beautiful conference, good afternoon. This is Dr. Onindo Rahman. I'm saving you from my pronunciation. Yes, I'm the program manager for National Antimicrobial Resistance Containment Program in Bangladesh. So I think I can share some of my experiences and my perspective from the implementation of the strategies that we are seeing. I will start by quoting one of my statement from our Honorable Prime Minister, Her Excellency Sheikh Hasina. And as you already know, she's also serving as the co-chair of the Global Leaders Group. And in one of her speech, she said that enough strategic documents has been prepared, enough evidences has been generated, now it is time for action. So I think that is also the essence of today's session, that how we are implementing the strategic activities that we planned, both globally and also nationally. And one of the key things, the key challenges, that is the coordination. And because I'm the program manager, so I'm hoping that I will shed some light on the coordination, how we are coordinating in Bangladesh. And if I'm being honest with you, I think Bangladesh has come a long way in terms of coordination. Although we started very early, we just started in 2018. Our strategy was approved, a national program was initiated. And obviously you all know that COVID has destroyed 2 years of our life. But still we did some work, and I think our coordination has improved a lot. We started obviously from human health, like many other countries. And soon animal health, the Department of Livestock, they joined our efforts, and they are very much active right now. Fisheries, they have recently joined our effort and very much active. For environment, we're still trying. They're with us. I'll give you some examples. So they're with us, but still they need to do some more activities to, more aligned with our activities. Just for example, just 2 days ago in Bangladesh, we had a big meeting to inaugurate the World Antimicrobial Awareness Week. And with the presence of our Honorable Health Minister, Mr. Jahid Malik, who is also very active in AMR. And all the heads, like Director Generals from animal health, livestock, fisheries, drug administration, they all joined. Also high officials from environmental sector, they joined. From agriculture sector, they joined. So it shows that, yeah, they are already on board. They are with us, and they are trying to implement activities. But unfortunately, so far, only human health have funded program for AMR in Bangladesh. And for animal health, although they don't have dedicated funding from the government, but they have some other fundings from different sectors, and they're also working on AMR. But I think for environment or agriculture, they don't have dedicated funding, and they don't have dedicated activities, which are trying to address recently. And just to say you, because I already mentioned that our Prime Minister is very much active in AMR, and this kind of high-level commitment, it helps when you're trying to coordinate and speed up things. This kind of things helps, and it is helping us. Before I finish my concluding remark, just to, because I got the chance, just to say you, like the challenges of AMR is obviously versatile, lots of challenges. But I think the countries like us, Bangladesh or other developing countries, we face some challenges that is not shared by developed countries. For example, over-the-counter sale of antibiotics. I'm pretty sure it is a non-existence issue in many countries, but in Bangladesh, it's a big issue. We're struggling, and it's not straightforward. It's not just a matter of regulation. You have to change the behavior and practice of common people, the farmers, the pharmacists, the village doctors, the doctors. So it's a big challenge. Also, for example, water, sanitation, hygiene. I know it's not a big issue in developed countries, but in countries like Bangladesh, it's a big issue. And I don't think only human health or animal health or environmental sector can address that. We need other involvement, like engineers, local government, local administration, all those things. Same goes with climate change. I mean, climate change is increasing infections in Bangladesh already. We know the evidences. There are lots of evidences. So if we cannot control wash, if we cannot control climate change, the impact of climate change, so the infections will keep rising. And I do not know if infections keep rising, how we are going to contain AMR. So that is my concluding part. I hope to say lots more in the discussion part. Thank you.
Yes. Thank you very, very much. And you are very right. The challenges might be different, but some have already faced those challenges and they have found solutions. So sharing those experiences and technologies is key. Now I pass the floor to my co-moderator to continue.
Next will be Dr. Amal Armani from the Sultanate of Oman.
Thank you, Mr. Chair, and thanks for including me in this panel. Maybe I'll start by sharing the experience of my country when it comes to the AMR, and through that, to have some insights of what we think would be the best to go forward from this experience. At a personal level, I started as an infectious disease consultant, so in the field where I have been treating patients for infections. And being graduate in the recent century, I thought that I wouldn't have much of business in the field of infectious diseases after the vaccines and after the hygiene improvement. What we had, unfortunately, was more challenging. We had patients with bugs that is resistant to very broad spectrum antibiotics, and we stand there thinking and scratching our heads in front of the patients, not knowing what to do and how to treat them. And every time we go to a certain modality, combining therapies, asking for new therapies that we were told that it's better than the X1, and bringing it into the scene. And doing this for some time, we have realized in the medical field that we are really running into a circle, that we ourselves are contributing to more emergence of resistance. And slowly we have realized also for patients who were not in our radar as a risk for antimicrobial resistance, which is the usual patient that we would be screening when they are coming into the hospital, whether they are carrying a resistant bug. It's not the usual one that we use to do the screening for as an infection control, who are customers of hospitals or who have been abroad for treatment. Suddenly, we have started to see people coming from the community. A lady who is coming to deliver a baby had never been in hospital, and here she is having a urinary tract infection with a very resistant organism that you cannot treat with oral antibiotic. You have to admit her. The baby would come, premature, being in the ICU because of prematurity for that infection. And here goes the morbidity, the mortality, and the consumption of resources. Each one of these patients has complications that would drain the resources, and it would also take the attention from other diseases where the medicine has been advancing, like cardiac diseases, intervention for cardiac diseases, surgeries. And we felt that we are going to go into an era where the revolution in medicine is going to stop because we are not able to manage the infections. And unfortunately, the science always lagging behind to tell us where to act. The science of showing that the antimicrobial resistance comes from the environment too is recent. We, for a long time, thought that, for example, MRSA, the first known bug to be resistant to antibiotics, was made in hospitals. But actually now we have studies that showed it was much earlier in the environment and in the animals before it was reported first in the human beings. So that sends a very, very strong message that we might be really going into the wrong track in managing this antimicrobial resistance. For years and years, we have been asking for new and new and new antibiotics. And obviously, we came to a time where we realized that we don't have much of room to have new antibiotics. They might be new, but not new pathways where we can overcome the resistance. So they would be used for small time, and here you are resistant to. So we came to realize, before even the concept of One Health comes up, that we are missing the environment part, we are missing the animal part, the nutrition part. So what we have done in Oman, taking this at a national level initially, we have utilized the Global Action Plan announcement, and that it has that really voice in the UN to establish an action plan at a global level. And through AMR, we had improved the hanging fruits. We don't have time to wait for innovation, for treatment, but we have already within our structure infection prevention and control that we can invest on it and improve it, and this is our hanging fruit, so that, you know, investing on the prevention not only in hospitals, but also in the community through vaccines, through improving the hygiene, through the education of the community, is hopefully gonna, you know, help at least in preventing the infections. Preventing the infections, you are not gonna see it in the hospital, you don't have to consume more antimicrobials. Preventing the infection in the animal sector is gonna do the same thing. You are not gonna be pushed to utilize and consume more antibiotics in the animal sectors, and prohibiting the antibiotics for the growth promotion for the animals is also gonna buy you time. So we are hoping with that, we are tackling one part, which is the spread of the AMR, but we are not controlling the emergence of the AMR, because that is another aspect. And to control the emergence of AMR, you need to sustain those actions for a long time, and also to work on the innovative part of finding solutions. So if we would have one advice for the countries right now, is that your hanging fruit is the infection prevention and control with all its pillar. And currently, maybe you have heard that, you know, the World Health Assembly 75 has endorsed the global strategy for infection prevention control. It's going to be ready in the WHA 76, and that strategy would be followed by an action plan for the strategy and indicators. But right now, what we are doing in this conference is also doing something else, which is trying to activate the action plan for the AMR as a whole, and this through putting indicators for the consumption of the antimicrobials in the different sectors. And by that, we don't mean to say that, you know, you go and cut down the antibiotics and just stop using them. What we mean by that is through cutting down, through improvement of the all aspects of health in human and in animals. So if you improve your diagnostic and you can treat patients with appropriate antibiotic based on rapid diagnostic tests being provided for the end users, you are improving the health in the animal, in the human sectors. You're indirectly cutting the need for antibiotics and the consumption of antibiotics. Your stewardships with all these aspects is going to do that trick as well. Last but not least, funding. Last but not least, having structure for monitoring and governing all of those efforts. And this is really the big hindering channels. Most of the countries have committees for One Health or committees for AMR. People change very rapidly. Let's face it, you know, this is the practical issue. Today, X person is in this committee, Y person is moved into that committee. There's no sustainability. Agenda's changing. Now it's AMR, tomorrow comes COVID, throw AMR away from the list, the committee is not meeting. So I don't think having a committee personally, and this is a personal opinion, is the way to go. I feel we need to move into having a governing structure within countries, not for AMR, but for One Health, where AMR is on top of the agenda of One Health. The other thing is that all the countries have national security agendas, where they do risk assessment. To be able to address AMR politically, you have to be showing AMR within that as an issue for the countries, not for the globe. So as a risk assessment to come to the priority of the governments and to be within the agenda of the security of the governments. Last but not least, the financing, whether it's a structure body or whether it's a committee that is having more monitoring and governance, it would need fund to sustain its interaction rather than finding funds from here and there. Thank you.
Thank you so much, Dr. Amal, for revealing to us what Oman has been doing. We're talking about country implementation. And you just heard from Dr. Amal how Oman decided to go down to the upstream. What are the problems? What causes this? And the route you've taken doesn't cost much money. You're talking about prevention, 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 prevention. Thank you so much for also highlighting what Oman has done in terms of getting the sectors, all the various sectors to work together. We'll still hear more from you. May I now invite from the Netherlands, Dr. Rosa M. Peran Sala. Am I right now?
Yes.
Please, let's hear you.
Thank you very much, and thank you, first of all, for organizing this conference and, of course, this panel discussion, and invite the Netherlands to share the experience that, our experience on antimicrobial resistance actually starts many years ago. In the Netherlands, we have been active on antimicrobial resistance, I think, for more than 15 years now. And let me explain a little bit what was the situation, where we are coming from, to understand a little bit how has been approached and how we have approached this problem. So the Netherlands, is a small country in Europe. And I say small because if we compare with Oman, I think it's 4 times smaller or something like this. But if you compare with other countries like China, India, it's really small. From above, it's 200, 300 kilometers, so it's really small. But it's very density of population. We have 17 million people living there. But what is even worse is that we are sharing this country with 130 million animals. So you can imagine that the situation is complicated in some issues. So in many years ago, we had some issues that make everybody aware that we had to be conscious about this situation and how to and the possibility of problems on it. We had at the time was a little girl, I think was 7, 8 years old, that has a heart problem, and she was the parents had a farm, pig farm. And she couldn't be operated because she was MRSA positive. So she was really, that was something that was on the television, on the newspaper, and that people realized that this interaction between humans and animals is really affecting and can affect everybody. We had also issues about Q fever, and then started also being very famous on the newspapers about the ESBLs, etc., etc. So antimicrobial resistance became an issue that was not only between professionals, but also the public was speaking about it and making questions. And then at this moment we realized that the Netherlands in the human health sector had a very strict policies on use of antimicrobials, but in the animal veterinary sector was not the case. So we had there not really strict rules, and at the time was not very much data on it, but from the countries that had data available was really huge use of antimicrobials, especially if you compare with this strict policy in the human health sector. So that created a debate, and actually this debate was translated at one point, went also to the political level. And then is when I think that we can say that this makes the change actually, because this political conclusion, this political debate also push us to take action and to find solutions on it. So at the Parliament, the Ministry of Health and Agriculture actually decide that they had to reduce the use of antimicrobials in the veterinary sector, and they put a target. But even if we thought that we were very good at the human healthcare sector, they put also targets for the human healthcare even to try to improve more the situation. So they said this 70% reduction in the veterinary sector, and yeah, was not really science-based, was just a number set by a politician. And the technical people had, yeah, how are we going to do it? And now that is the introduction, but maybe later we can discuss a little bit more, especially because our chief veterinary officer is here and he can explain very detailed the way that we approach this. But with this, I want to say that for us, I know that in the world, no one size fits all, but everybody has to take measures that are really fit their own situation. But there are some common issues that may help, and the experience from others can also help. In this case, for us, putting these targets, even if we thought now they are not really based on any data, just numbers, but help us to approach the problem and to try to find solutions. And what I think that is also very special from the Netherlands is this One Health approach. At the moment, in the 15 years ago, we were not speaking about One Health. We were only saying that we are collaborating together, Ministry of Health and Ministry of Agriculture. And I think that this was also essential. And also the mobilization of the stakeholders, because at the end, as government, you cannot do it alone. You need to work together on this. You can impose, of course, things, but if you think together and you try to understand and also contribute to the solutions together, I think that then you can have better outcomes on your output. And then we decided to put all together, even if we were doing actions in 2014 when we did organize the first ministerial conference. Actually, that was our target to go to the National Action Plan. And that was a plan that was signed at the time by the Ministry of Health, Agriculture, and also Environment. And the minister sent a letter to the parliament saying, this is our National Action Plan, and these are the targets that we are going to put in place, and we will report you every year how we are advancing on this. So every year since then, we have been writing together with both ministries a letter to the parliament updating on the state of play of the situation. So with that, I just want to emphasize this political will that is the only one to help. And this political will is also linked to financing and is important for financing and for engagement for all the sectors. Now, I think that for opening remarks, I will let here, but maybe we can go further later.
Thank you, Dr. Rosa, for that interesting perspective from the Netherlands. And you've been at it.
I forgot to say that we have already the 71% reduction in the human healthcare, in the veterinary healthcare sector, and that in the human healthcare sector we have also improved, even if we were already good.
Very important. You've already exceeded what is being proposed. Well done, Netherlands. And from the panelists, two things have come out. One, reduce use of antimicrobials. The other aspect is looking at the environment in general. We can live with these microorganisms, but we can stop them from coming to us. I like this second part because the environment, sometimes we don't understand the environment. In Nigeria, there's a particular part of Nigeria, the problem there is poisonous snake bite. That is a big problem. And years ago, some brilliant technical people said, let's go kill all the snakes. Do you know what happened when they tried that? Rodents, rats took over, ate up all the grains, and the villagers now protested and said, please leave the snakes with us. I hope we're not going to face the same thing with the microorganisms if we're not careful. Jacqueline.
Thank you. I'm very sorry I was laughing, but in reality I was reflecting, because what I am hearing is the story, and you are telling it from your hearts. So that makes a whole difference, because we care and we can really get into very good conclusions. But also it reminds me always of, you know, I like movies, the never-ending story. And what I am hearing here in this, with this panelists and their experience, is what I hear, for example, with pesticides. Who is the vulnerable population? Everybody talks about the workers, the farmers, but in reality, when you go a little deeper, you see, wow, the wives, they are cleaning and washing the clothes of the husband. They are cleaning the containers. They are sometimes even more exposed because they don't realize that problem. And in here, the stories we have been hearing always comes into that circle that was mentioned by Dr. Amal very, very strongly. One Health is part of the solution, because it means that we need to look broader, not only to the little thing, little big thing that we are addressing in one moment in time. So what I would like to go now is to deep dive in some of the concepts that our panelists have indicated and share with us. And maybe I start again with you, Dr. Rahman. And you mentioned several times the word coordination, right? Coordinating committees. The question for you is related to the progress, because from what I understand, you are already working with that setting, but in reality what we need to know is the progress from your viewpoint, and also how are you tracking that progress? Thank you.
Thanks, Jacqueline. Regarding One Health, so I'm very happy to say that in Bangladesh, we already have a platform. We already have a coordination mechanism. And I think it started in 2017. So that time a new One Health framework and action plan was developed and endorsed by the ministries. And that action plan actually led to a One Health Secretariat, which is actually housed in the Director General of Health Services. But it has a proper structured mechanism of involving other ministries, and a coordination started. So in that secretariat, how it works, so dedicated officers from human health, animal health, especially livestock officers and also fisheries, and one officer from either from environment or wildlife sector. They are dedicated for this task and they are stationed there. So they're supposed to coordinate it on behalf of their sectors on their ministries. So this is one part, the secretariat. Also there is a national committee, One Health Committee, and national working committee as well, working groups. And those kind of groups and committees, they have regular meetings. And this is obviously One Health meeting, so all the sectors are very much involved. And that's how this coordination mechanism works in Bangladesh. And I would say it works very well because it successfully worked especially for rabies and also anthrax and bird flu in Bangladesh, and also a little bit for Nipah. And I've seen this in action, like they were very much active during flu season. Also now they're very much working together for rabies elimination. So so we are trying now to involve this mechanism into AMR as well. As you know, AMR obviously have different committees, but it's very much aligned and they're very much involved with us. For example, we just updated our national strategy, and this group, this One Health coordination mechanism, the whole group was very much involved, actively involved in the development of the strategy, updating of the strategy. They were part of the working group, and obviously they provided their inputs, feedback, and the fisheries ministries, the livestock ministry, they provided their input in a written format as well. So I would say they were very much engaged, and that's how this One Health coordination is going on. Now to answer your question regarding how we are tracking the progress and how we are accountability, you know. So this thing, I would say there are a few issues. So one, we have a surveillance, One Health surveillance. So that is one part of the puzzle. So we are keeping the data. We're tracking progress through data, what has been done and what needs to be done. And we have a dashboard as well. It's a public dashboard, so anyone can see that. So you can see the progresses that we have done in the One Health aspect, the important aspects of One Health. I think the meetings, the National Technical Committee meetings, that is another area to actually see the progresses, what are the people doing, and making them accountable. That is another aspect. Although we do not have any national annual report like Netherlands do, but we are planning to implement that so that we can say what we are doing in the annual report and we can mention the progresses. Yeah, that's how Bangladesh is doing. Thank you.
Thank you very much, and it's impressive always, all the efforts, right? And we are very proud of how much you have accomplished, and in particular because you were referring also to the political commitment very strongly, and you are part of the GLG as a country, leading all of us, so congratulations from our side. Dr. Amal, you mentioned a lot of challenges when you were referring, and you also provided a lot of solutions or ways forward, paths that you have found in Oman. So if we go a little, zooming in a little more, and we talk, for example, about indicators of One Health monitoring implementation, right? And what can be, in your view, and in relation to your experience in Oman, be improved? Measures, you talked also about preventive approaches. You have WASH, you have infection prevention, you have codex. There are different elements. And you also mentioned very strongly regulation is not the only solution. So please, over to you.
So as a start, we have been working on the processes more than indicators and targets because we needed to build the system to get into those targets. The processes for surveillance. So we have our national surveillance system, the OMAS, which merge both the surveillance for the antimicrobial resistance in all the pathogens. That includes TB, viruses, HIV, fungi, recently with the Candida auris. And also, in addition, we have the utilization of the antimicrobial as part of that report. We are lucky because we have electronic medical system, which had really eased things, whether on the prescription side or on the laboratory side, to pull the data and make it easy to be verified later on and to have a report. That report was really, really an important start because it's just opened the eyes on the magnitude of the problem. And this is really important when you want to start for putting things into the context of the priority, whether at a ministerial level in your sector or at a national level. We have also, through that report and through the initial conference that we had along with colleagues in Ministry of Agriculture at that time and Fishery, we have presented certain data which made the colleagues in the agriculture side also have the insight to the risk and the need and urgency to work. So there have been registration also for the antibiotics used in the agriculture side, and they have also had some restriction for the antimicrobials of importance in human side to be utilized in the animal side. The indicators that we work with them is right now, it's not like a fixed indicators to say, we have to achieve that through this year, but what we do, we review these reports on an annual basis and give feedback where the areas of utilization have been there and the areas where there is more resistance to the antimicrobial. So for example, to utilize it to strengthen more the infection prevention and control, or to restrict certain antimicrobials. We have restriction lists, especially for the primary care. We don't really give permission for the prescription of broad-spectrum antibiotics in primary care. They have restricted list of antibiotics, and if the patient needs broad-spectrum, that comes to the attention of the secondary and tertiary care. So we can also, through that, measure where things are trending, because if we leave it open, so it wouldn't come to our attention. The one thing that I would also mention is and interesting things. It's about the media and the health promotion part. I was recently during this week, because it's the Antimicrobial Awareness Week, in an interview in the radio, and one of the audience has asked a question which the interviewer thought it wasn't relevant. He asked about TB. In an interview about antimicrobial resistance. So she wanted to say, this is not TB, this is, this is antimicrobial resistance. And I took it from there and I said, no, this is really to show how prevention can be powerful. She said, are we seeing TB in Oman? I said, exactly. You don't hear about resistant in TB in Oman, because we have such a good prevention program, monitoring of contact, if there is an exposure to a case, a screening for people who are at high risk, that we rarely hear about TB, that it became very scary for people if you pronounce that, a person have TB. So what does that tell you? If we left TB, at least I'm talking nationally. I know there are different countries and different epidemiology of TB in countries, including the resistant. But I would say from our position in Oman, because we had really a strong program for TB there, we hardly see about TB infection in an indigenous population in Oman. So that is a big success. And that big success say, if we really concentrate on the prevention, we don't see the infections, so we wouldn't see the resistance, and we wouldn't see the resistance within the pathogen. So we have been using those as a success story in promoting for the antimicrobial resistance. We have to be very careful in our messages to the media and to the politician. If you give them, a very black future, saying, and without really working into promoting for solutions, and what do you think the solution can be on the short run and long run, it's a lost battle. And same with people. If you think that, by telling the people how bad the situation is, people also going to be afraid, but they would feel that they can't do anything. So why you are telling us about the problem? But telling them that, doing this have success and have shown success, this is where health promotion, and this is part of the action plan. I'm not going away from the action plan and countries' implementation, but I think we need really to advance our tool in our health promotion. We have to go away from freaking people about things as a way into getting them engaged, rather than maybe sharing success story like the Netherlands for the agriculture. Believing that using antibiotic is a good health, is a good growth promotion, and they will sell more and it would bring more to the economy. The Netherlands and other European countries which have really implemented restriction for the use of antibiotics as a growth promoter did not affect their economy. In fact, now people are asking for food from those countries where it's labeled as antibiotic free. So this is also another message when we talk to the other colleagues in the other sector to promote, for more actions to be done and to get them into buying into the solutions for the AMR.
Thank you so much. I will add the TB to my speech. I usually use polio as an example. If you stop the vaccination, what will happen? It's very obvious, the response to that. But TB, unfortunately, in some countries is growing, so I'm very happy to hear that you have it controlled here in Oman. My dear, over to you.
Thank you. Since morning, we've been listening to various speakers, and it seems to some of us that the big elephant in the room of country implementation goes by the name political will. What is it really? And how can we drive up political will for better coordination and ownership? In my own limited experience, lack of political will thrives where the political leadership of a country is ignorant of the existence of a problem and its importance and implications. It thrives when the political leadership rates a problem low in priority. It thrives when the political leadership sees no political capital in championing a cause. But definitely, it also thrives where there's little or no resources for fighting the cause. I think politicians will applaud me for this last point. That's their own reason all the time. So, we're going back to the Netherlands. Dr. Perran, we know that funding is often a barrier for the proper implementation of the National Action Plan. So could you give us some innovative ideas for mobilizing resources from the different sectors?
Yeah, I don't know if it's innovative because we are always speaking about the same. And at one point, yeah, about innovation in this field, I think that that we don't need to reinvent the wheel. We have already things in place. And I agree that maybe the Netherlands was in a privileged situation because resources, when this political will was there, resources was automatically linked to this political will, and that is very easy then to start thinking and approaching the issue and putting measures in place because you know that you can go through and implement properly. But this is unfortunately not always the situation, especially in low middle income countries. You see that even if there is the political will, there are limitations, and the limitations are funding, but funding is not only money, it's also capacity and human resources, and that these people is trained, and that you put in place things that are sustainable actually, because that these otherwise these efforts are also for nothing. So that's why in 2019, when we organized the second ministerial conference to support the tripartite at the time, now fortunately we are speaking about quadripartite. So, but at the time, one of the things, the outcome of this second conference was the creation, the launch of the multi-partner trust funds. And this has been the mechanism that has been supporting some low middle income countries, especially on implementing these national action plans. And I think that is a very good way of a good mechanism, because it's not only financing and giving the money, but also the technical expertise of the quadripartite to help them on structuring and per country is analyzing which are the needs and helping in this way. One of the things, of course, is that this multiple partner trust funds is helping for a period of time, 2-3 years now. We are fortunately, due to the pandemic, things were slowing down a little bit. But what happens after these 2 or 3 years? And I think that here we need to think all together how is the next step. Of course, are we going to expand these multiple partner trust funds, going to a global fund? We are now also in the pandemic treaty discussions about this fund that has coming also with a lot of money. That prevention and antimicrobial resistance can also benefit for it. But at the end, we need a more structured funding, and that the actions that are started can be sustained. And that doesn't mean that we have to postpone activity until this structural funding is created. And the multiple partner trust funds is already there, so this can act, and then thinking altogether on the future and how to make it sustainable, because this is at the end what you need for low middle income countries.
Yeah. Thank you, Dr. Perran, and I like your last word on it, sustainability. Don't start something you're not likely to finish. I think it will be good to hear from the audience. You may have questions, may even have comments, but please, let's be mindful of the time so we can maximize the little time we have remaining and permit of more audience participation. Yeah, so you get the microphone and then introduce yourself briefly. No, for the recording. We need someone to.
Assalamu alaikum. My name is Maha Talat. I'm the regional advisor for AMR at EMRO in Cairo. My question to the panel, we heard a lot on financing and we heard shortly on capacities. And I believe one of the big challenges of implementation within countries are the capacities needed in so many areas, whether across humans, animals, the plants, the environment, surveillance, IPC, biosecurity, biosafety, stewardship, treatment, and the turnover that exists in many, many countries. And how to deal with this issue, because sustainability can never be happening except if you have a cadre of specialists and experts within the country. Right now, funding can be provided, capacities or expertise can be provided, but we are seeking long-term capacity building. So any kind of experiences within countries or among the panelists to advise low-middle income countries, particularly on national capacities for AMR response or preparedness and response. Thank you very much. Thank you for the
Good question. You want to give it a try, Dr. Rahman? Okay.
I'm pretty sure all the panelists can share their experience. I can share just one recent experience that we had in Bangladesh. So I think everyone knows the name Fleming Fellowship. And that fellowship started in Bangladesh 2 years ago. I'm one of the fellow, and there are 10 other fellows in Bangladesh from different sectors: human health, animal health, fisheries. And I think this is one approach that I'm just trying to give an example. And I've seen this fellowship worked really well. Not only these fellows were they got new knowledge, new information on AMR, but they became very much active. Because I'm the program manager, I have lots of programs to attend to. I also organize lots of programs, and I frequently goes to other sectors, initiatives, programs. And now I see all those fellows has become very much active in their activities, and they're leading from their sectors. So this kind of fellowship that bears international recognition really motivates people. So this is one aspect. Another aspect is to obviously create something like Fleming Fellowship, but for the national. So if we can arrange some kind of fellowship in within the nation and invite the people from active young people from different sectors and train them and provide them certificates. So it should be a structured thing, obviously. I think it can also motivate people and make this more sustainable. Thank you.
Dr. Peran, you started all this issue about sustainability. Over to you.
That is actually the tricky point about implementation, as very much said. I want to share the experience also that was actually originating after the second ministerial conference, and that during the conference we launched the multiple partner trust funds, but also the possibility to have twinning projects between countries. And the Netherlands started, and our minister mentioned this morning, a twinning project, for example, with Curaçao. And this has already been evolving, and we can share with you the results of these twinning projects. So that allows also, twinning allows also to take care one of each other. And also another experience that we have from the European Union, we are now starting the second joint action on antimicrobial resistance. This is a project funded by the European Commission for EU member states, but also some other countries are invited to join. And we are working in this project for 4 years. The idea is also that learning one from each other and helping one each other to improve, to analyze, to have these, for example, country visits or other tools, instruments that help each other to improve and to advance on the implementation.
Okay. Do you want to add anything, Dr. Ma?
Yeah, I'll respond to Maha's questions to the ground of the practicality. So when it comes to real life capacity as human beings who are working in the field, and how really we can provide all of this human forces to implement all of this in addition to their work. And I think the one way to go is in this era to use the artificial intelligence, to use the electronic systems. And as I said at the beginning, when we went for the OMAS, the Oman antimicrobial surveillance system, we have utilized the platform that we already have for the electronic medical system to get the data. If we have relied on the reports to come to us from the hospitals and from the health center, I can reassure you that it would be a tiring process for everybody. It's already a tiring process to verify the data, but at least we can get the raw data directly through the electronic medical system, through the IT systems. I think if we are advancing everywhere in all the sectors, and the artificial intelligence now is everywhere in all the sectors, why not in the health, why not in One Health? To ease the processes, I think getting this capacity is going to decrease the need for the human forces and also the issue of the turnover. And the other thing, and at the level of countries and at the level of organizations, supporting each other. There were twinning processes during the previous, high-level ministerial meetings that were shared. Countries which have already done a lot, have a lot of experience in the AMR, implementing One Health, twinning with other countries, helping them through the process with their expertise and through the continuous learning. And we have seen really excellent examples, and I'm sure it can continue throughout, the time with the other countries. So, organizations, as part of the funds that goes to the AMR, is supporting building capacities for low and middle income countries so that they can achieve the indicators. So if these indicators are going to be bought in at an international level and United Nations level, so I think it would be also the responsibility of the nations to support each other by building the capacity of each of the countries through as one part where this fund should go, so that the globe as a whole would reach into those indicators, and hopefully by time where we can have more innovation and more solutions for infections other than the antimicrobials that have already lost their effectiveness.
Thank you, Dr. Mao. Collaboration. But I like something you said. Where does this money go to? So when you ask countries, why do you need money for MR? I'm sure some may be surprised at the question, but it's also important because then it makes it easy to know where to channel whatever little resources you have. There are more hands raised, but before that, I don't know. Before I'll come back to you, I saw one hand there a little earlier. Who is moving the microphone for us, please? Organizers? No. Thank you very much. Thank you. Yeah, the lady over there. No, you've passed her. I think there was a lady raising her hand here. Okay, you've already spoken. Elizabeth.
Okay. Thank you very much. I'm Liz Taylor from WHO, and I was at a global level and I'm now at a country level in Egypt. And what is really exciting about this meeting is that we are really starting to talk about the sectors sort of substantially. It's not just the ITU, the tip of the iceberg where it's visible, but it's the whole. But the problem is that we don't know what's going on and what the magnitude of the problem is, either in the community use, in the health sector, or in the animal sector. And the plant sector, I think most countries are really struggling to get to grips with at all. And I think this is really important for us going forward, and would love to have the panel's ideas, because, as you said, understand the magnitude of the problem and then you focus your activities. And I think it feels, certainly in a lot of countries where we're working, we really need to get to grips with that and ideas on how we do that. And just, I think, on your point about where do we use the money, I think we need to be very careful that we don't create an AMR silo. And so much of what we should be doing is good public health and good animal health and good plant health. So sure, we need a bit to coordinate and catalyse, but let's strengthen the whole systems and really pull the whole ministries and systems together to take it forward. But I'd love your views on how we get to grips with the magnitude of the problem on these other sectors. Thank you.
Thank you. Before we give the opportunity to panelists to react, can we take another comment or question? Okay. You've changed position. I was looking for you, but don't worry.
Thank you. I wanted to build on what was said in terms of scaring people with message like silent pandemic, the negative impact of the advocacy that's based on fear has been also documented. And I want to also build on what Liz has been saying in terms of silo versus motherhood and apple pie in public health. There's a number, if I speak for the health sector, which is what I know, I think there's, for AMR, the approach for AMR, whether it's for what's happening in intensive care unit in the hospital versus the disease specific, I think could be linked in a stronger way. Malaria has been a leader in AMR for many years because there was an issue, TB, HIV, all the others, and all of this is the same principle. It's about the standard treatment guidelines and stewardship. It's about surveillance, about access to first line and second line. It's about all these basically core public health functions. So if we want to be a bit more specific, as Liz was saying, and not create some AMR silo, one way to think about it is these cross-cutting health system building block in core functions that can strengthen AMR for bloodstream infection and that sort of bacterial infection, but also across the board for HIV, TB, malaria, typhoid, and a number of other things. Thank you.
Thank you. The panelists, please note, yeah, to the big man there. So when you look at it, you know that one size will not fit all.
Thank you very much, Program Director and the panelists. I think Liz said mostly what I wanted to say. And also the speaker just before me mentioned issues about malaria and so on. I'm a veterinarian and from South Africa. And I think I liked your example on the snakes and the proliferation of rodents afterwards. But from Africa's perspective, we should also be looking at the fact that there is a lot of wild animals. There are tsetse flies. You know what I mean? Sleeping sickness. And of course, there are also livestock threatening diseases like cowdria, ruminantia, heartwaters, those who know what I'm speaking about. Of course, some of the typical treatment regimen for heartwater, for instance, the farmers would go for tetracyclines. I know that tetracyclines are not that high a list, but you understand what I mean. So we suddenly have other diseases that maybe could have been controlled due to the use of antimicrobials. Now we're no longer using them. But at this moment, we don't have alternatives. Of course, for heartwater, you can vaccinate. But for the other conditions that can be treated with AMR, antimicrobials, what are we going to do? So I would like to hear the opinions from the panelists. What are alternatives? Thank you.
Thank you. Any more questions? One more? Okay. Okay, so two of you will be the last before we hand over. Yeah, just two more, and then get the panelists.
Thank you, Chair. I'm Wim Pelgrim, the CVO of the Netherlands, and don't be afraid, I don't have any questions. Just some positive remarks, I think. My colleague Rosa mentioned already that in the Netherlands we reached 70% reduction of the use of antibiotics in animal production. And we didn't reach that number from one day on another. So it took some time. So countries shouldn't get demotivated by that number. We can't reach that because it's a high number. You should work from year to year, and then a lot is doable. The other thing is what we learned in the Netherlands was, and Rosa mentioned it also, that the cooperation between the different parties is essential. So the private parties, the vets, the farmers should work together, and should work together also with the government. And I'd like to come back to an advice that Monique Eloy, the DG of the WOA, mentioned, that you need a strong veterinary service for working on a theme like reduction in the use of antimicrobials. And the WOA also has instruments to strengthen veterinary services around the world, and countries could use those systems, and strengthening the veterinary service also helps to make programs of reduction in antimicrobials possible and more practical. And the last thing I would like to mention, that we saw in the Netherlands that the reduction of the use of antimicrobials did not affect the economic position of our farmers. And I think Rosa mentioned, for us it was maybe easier because we have financial resources for a program in antimicrobial reduction. But I think this applies for every country. I think in the end, prevention is less costly than reactive use of veterinary medicine. And I think that should be a driver as well. I think it's economically worthwhile to work towards less use of antimicrobials. Thank you.
Thank you for the encouraging words. And the last comment or question over there. Yeah, raise your hand so they will know. Okay. So panelists, get ready.
Thank you very much. My name is Thanawat Tiansin, Director of Animal Production and Health Division at FAO. And also as a veterinarian, I just pick up some point from the CVO of the Netherlands and also CVO of South Africa. One of the issues when we go to the developing countries, and also when we talk about reductions of the use of antimicrobials, is also will bring to another issue that how we're going to offer to our farmers in terms of best practices, in terms of, for example, how to have others alternative like feed additive, vaccinations, animal-based animal husbandries. Because once we get the best practice and also have an options for our producers and farmers, and once they don't see any negative impact of their production itself, they will continue to see further, to share more expertise and also to share best practice among themselves, among farmers and producers, as CVO of Netherlands mentioned earlier. We know that once we see the positive result, we can expand best practices among producers and farmers. And that's why to make sure that when we're talking about the reductions, we also need to give additional practices and also practicalities to our farmers and producers as well. Thank you very much.
Thank you very much. We're running out of time, but the panelists, you don't need to answer the questions. I'm going to give 30 seconds to each of you. You can pick any segment. Just 30 seconds, and I mean it, because we don't want to be asked to leave this hall. We'll start from you.
Yeah. So maybe as last remark to emphasize what has been said about the strength, that at the end it's about strengthening health systems, human and veterinarian systems, that I think that we have to put efforts on this because, yeah, antimicrobial resistance cannot be treated, has also been said, in a silo, is really linked to others. And I think that the pandemic has made visible that there is the added value of infection prevention, of stewardship, and that is what we have to work forward.
Thank you. Can we all emulate her?
Thank you very much. And I'll end by saying, that all of us is agreeing on the importance of this subject, and all of us agree that we don't have much time to waste, and we should invest on what we can do today and work on what we can do tomorrow step by step. But to start today, start with the hanging fruits, start with the infection prevention and hygiene, whether in hospitals and in community, and work in coordinating the sectors at the level of your country, and hopefully later on the global coordination would come up also with the support for the countries from organizations and from other countries.
Thanks. I think I would not add anything else because everyone said what I wanted to say. And I agree with the comments, especially, obviously, we cannot treat AMR in a silo. It is simply not possible. For example, in my country, we have 170 million people. We have very less number of doctors, very less number of hospital facilities. Maintaining those standards of AMR that we are talking about simply not possible if we do not strengthen the health system. And same goes to the animal health, right? We have 170 million people to feed. We simply cannot make error in our initiatives which decrease the food production. We simply cannot do. So the whole system need to go together, and we all agree. But we should obviously emphasize the importance of AMR because still not many people know what the impact of AMR, what it is and what it will do. So that we should address at least. Thank you. Thank you, everyone.
Thank you. Nice session, but let Jacqueline have the last word.
Well, that's good. Thank you. Yes, I think many things have been said. I will add very quickly not only the issue of health and animals, but also, for example, waste management. And sometimes we forget when we are talking about the topics that it's crucial. You will see that in our report that will be launched in February together with the GLG group in Barbados. So we are looking forward to that, so the publicity goes. But when I look at what we are doing, it's like we human beings, we like numbers, right? And here we heard a lot of numbers, and we heard the amount of deaths from AMR, 1.25 in 2019, plus collateral going more than 5 million. We know, for example, air pollution, 4 million deaths per year. Lead issues and legacy, around 2.5 million per year. But this is not a competition, right? It's time to act, no time to waste, as was mentioned here. And particularly, there are solutions available that are simple. As I was saying, collection of waste, for example, in the environment side, prescription, those type of things imply change of behavior, and that's not easy, but it can be done. And we have heard examples here. And to finalize, I'd really like to thank you, our panelists. A big applause to all of them. It was really very good, your contributions. To you for listening and being with us and asking a lot of questions, so the coffee will be very interesting for the panelists. And before we go, a big thank you, Amal. Oman has been doing a fantastic job, not only at the national level to address AMR, which is the topic here, but as a host. We are very much impressed, and thank you so much for your hospitality. And thank you.
Exit strategy. So you are admitting now you are not young. No, she is. Her long-term retirement plan, 20 years time. So we brought another chair.
Yes, but not when we speak, we don't need to stand up. No, that is good, because we always stand. For an old lady, that would be more comfortable at this time of the day. And now I'm not talking about you, but myself. But I have to say, and I will say that, you know, he's a senior of the Netherlands, 25 years ago. So, come on.
the rapporteur on stage, or is she sitting there?
No, we don't have the rapporteur on the stage.
You sit on the...
I will, the two of us will be here. You are the first one. I think Joanne is the second one.
That's right.
And then Ahmed, and then Samuel and Samuel.
Thank you.
Okay.
This one, this year it was about food security, that's why. And healthy diets as well.
Then how you proceed? You introduce the panel, or I'll start and then you introduce the panel?
And then as you say that you
I will go the first one. Okay. Yes. Good afternoon to all, ladies and gentlemen, and welcome to this session focused on research and development. And we all know, and it has been said at the opening this morning, that research and development are pivotal to combat antimicrobial resistance, AMR. But when you look at the landscape of AMR and research and development projects and the correspondent funds by sector shows that the majority of the funds are, until now, mainly directed to the health sectors, towards research and development for the treatment of bacterial infection, with the investment of research and development for cross-sectoral and for the animal, environment, and the plant sectors still very limited. And we said also this morning that we need an interconnected approach. This is in contrast and with, as I refer, the common recognition that we need to tackle AMR using One Health approach. We are still lacking knowledge. We have knowledge gap and research, even though efforts are needed to improve our understanding on the development and the circulation of drug-resistant microorganisms and resistant determinants between and among sectors, and discovering the implementation, innovative intervention, and new science-based solution. Then we have this session on research and development and what we expect as what are the objectives and the outcomes expected from the session. We hope we'll be able to provide, by the panelists we have here, my colleague Hussein will later on introduce our panelists, we'll be able to provide an overview of priority research questions to be addressed for effective response of AMR in each specific sector, human, animal, plant, crop, environment, and across One Health, to present the main ongoing research and development activities aimed to understand, prevent, and respond to AMR across One Health within the implementation of national action plans on AMR. Third, identify the main challenges and possible innovative solutions and supporting research and development for public and private sector. Fourth, discuss on how to increment political and financial commitments to supporting research and development by governments and private sector for new therapeutics, known and newly developed alternatives to antimicrobial, diagnostic tools, and innovative solutions to control AMR and to reduce the need of antimicrobials. This is the objective of this session, and we hope at the end of the session we'll be able to have some ideas or some recommendations on how to move this agenda forward.
Now I am very pleased to give the floor to my colleague, Mashouri, who will share with me the co-moderating this meeting, this event. Hussein, over to you. I prefer to call you Hussein. It's easier for me.
Feel free to call me Hussein. Thank you, Marina Helena, for this introductory. And I think I should be starting introducing you to the audience. Maria Helena Semedo is the Deputy Director General Food and Agriculture Organization of the United Nations. Myself is Hussein Al-Masrouri, the General Director or Director General of Food Safety and Quality Center. I'm also an Associate Professor at Department of Marine Science and Fisheries, Sultan Qaboos University. And I would like also to introduce our rapporteur, Dr. Suzanne Eckford. She is the Head of International Office at the Veterinary Medicine Directorate in the United Kingdom of Great Britain and Northern Ireland. Welcome. And then our panelist to the left of Maria is Prof. Joachim Larsson. He is a professor of environmental pharmacology at the Department of Infectious Diseases, Institute of Biomedicine, and Director of the Center for Antibiotic Resistance Research at the University of Gothenburg, Sweden. And then we have Johan Hasso-Kallio to his left, and she is the permanent secretary of the Ministry of Agriculture and Forestry in Finland since 2012, and she has served different positions before that. And then the next is Prof. Ahmed Al-Harrasi. Prof. Ahmed is actually a colleague of mine. We studied together. He's a professor of organic chemistry and the Vice Chancellor for Graduate Studies Research and External Researches at the University of Nazwa in the Sultanate of Oman, and he's also the chair of Natural and Medical Research Center. And then we have Prof. Samuel Kariuki. He is the director of the Center for Microbiology Research at the Kenya Medical Research Institute, and also he is coordinator of the postgraduate medical microbiology course hosted by the Institute in Nairobi. And then we have also Dr. Hussam Zawawi. He's a principal investigator at King Saud bin Abdulaziz University, Saudi Arabia, where he teaches medical students specifically how to control infectious diseases and conduct researches on AMR to contribute to the global battle against superbugs. We will start with we will have around 40 minutes for a panel of some questions. We will start with an introductory remarks, one question for all of our panelists, and I'm kindly asking them the question, and I would like to have the answer in 3 minutes, not more than 4 or 5. The question is, what have been the most impactful research findings and innovation that have or are still contributing to the prevent, control, and mitigate of the antimicrobial resistance within your field of work and at the One Health interface? We'll start with you, Prof. Joachim.
Thank you very much, and thank you for arranging this nice meeting and also for inviting me. So I work at a center that works very broadly with antibiotic resistance, but my particular expertise is environmental dimension. So I'll give some remarks that are broad, but focus on the environmental ones. So the environment has at least 2 critical roles in antibiotic resistance development. First of all, it's an important source or reservoir for resistance genes that over time become mobile and accumulates into disease-causing bacteria. I personally think that most likely environmental bacteria already harbors resistance genes to every antibiotic humankind will ever develop, unless we start thinking radically different on how antibiotics are designed and work. There are several important studies that describe different pollution sources for antibiotics, causing selection pressures that in turn can drive the evolution and emergence of resistance in the environment. This includes the direct pollution from drug manufacturing, that can result in exceptionally high concentrations of antibiotics, higher concentrations in lakes and rivers than what you would find in the blood of patients taking the antibiotic. In such environments, bacteria are extremely multi-resistant, as you can imagine. This, I think, is a source for pollution that should, in relative terms, be easy to stop because it's a limited number of places. And I think we should intensify our efforts to stop that kind of pollution. I'm happy to discuss that with each one of you afterwards. A second role of the environment in AMR is as a transmission route for several pathogens, particularly through fecal waste. And here I think a major research finding is that on a global scale, the correlation between antibiotic use and antibiotic resistance is actually very weak. A study by Peter Collignon et al. A couple of years ago. The correlation between sanitation levels and antibiotic resistance is much, much better. Don't misinterpret this. Antibiotic use is still an important driver, but in regions with limited sanitation that enables the resistance to spread more effectively, the lack of transmission control becomes even more important. So therefore, I think improved sanitation should be much higher on the AMR agenda. Now, moving from the environment to the animal side, personally, I think the most important finding is that good hygiene and transmission control in production units can, to a very large extent, reduce the need for antibiotics. Just to give one example, in Sweden we produce lots of chicken and eggs, and it's to a relatively low cost, and still we hardly ever give any chicken any antibiotic. And this is because very strict hygiene control, of course. And I understand that the challenge is how to implement that in other parts of the world that have different economic, political, or educational, or geographical conditions, of course. But it shows that it's possible. And on the human side, I think surveillance data that illustrate the enormous differences in resistance burden between countries is critically important. But I think we have not really taken the full advantage of this observation. What we can see clearly is that countries that apply effective antibiotic stewardship and transmission control, they benefit a lot themselves, even if other countries are not implementing similar measures. And this awareness that even one-sided efforts or actions pays off should be a driver for action for every country to act and stimulate them to go beyond international agreements. Thank you. Presentation.
Okay. Hello, everyone. I'm happy to continue after Joachim's perfect presentation, and I'm happy to be here. So thank you very much for the organization. So I'm Jaana Husukallio from Helsinki, and I'm a veterinarian by training. And I could start by saying that in the 1980s, I was doing veterinary practice in Finnish countryside, but then I got interested in science. And the first things that I started was cultivation of Salmonella bacteria and doing the sensitivity testing of all the isolates. And I was very eager to listen to the Canadian comments in next door about that the testing continues. But life has changed quite a lot since then, and I just told that 25 years I was the CVO of my country, and since then I've been involved more in the policy making and administrative work. But I want to have a very pragmatic approach coming from the veterinary point of view, and to continue what Joachim you just said, because I think that we should be proud of also about the scientific work what we have done linked to good farming practices and good animal husbandry. Because of course the hygienic things that you were referring to is very much involved in animal husbandry as well. And as Monique Eloi said in the morning that in the opening discussion already, that prevention is always better than cure, than medication.
and the use of antibiotics should never be used to replace bad management practices and bad hygiene. But you have to have science there as well. You have to measure, and you have to show also the farmers, as was discussed in this room before. You have to explain the farmers as well, because the work costs, so that they understand that it costs even more if the antibiotics need to be used. So my main message about the history in the veterinary side and food production side is that you have to have the basic issues in order. So that means that you have a good care of newborn animals, you have sufficient space for the animals, you have good air quality, good feeding practices and the quality of feed for sure. You have free water access, you have minimization of blending of the animals to avoid any kind of stress. And of course, you concentrate on good biosecurity and eradication of the infectious diseases, where I know that there is challenge around the world still. And the treatment of individual animals based on proper diagnostic tools and means is the number one, also to protect the healthy animals from disease pressure. And another issue I wanted to mention is that the prohibition of the use of antimicrobials for growth promotion and the prohibition to use the antimicrobials for prevention purposes also have had the scientific work in the background. So that is not based on something that somebody has just mentioned, but there's a lot of work there behind, where you also have to be able to explain the farmers why to do that. And just one example to continue what Joachim, you said as an example, a very pragmatic example from Sweden, and it happens to be chicken in Finland as well, but broiler chicken, meat producing chicken that in my country we have been able to produce for more than 10 years the production animals without using antibiotics at all. And that is all based on the good management practice. And sometimes I think it is even almost impossible to understand that it is true. And when I started my veterinary career in the 1980s, as I told you, I had the privilege to work with Professor Esko Nurmi, who was the father of the competitive exclusion method, meaning that you gave normal flora to the newborn chicken to avoid Salmonella and Campylobacter. And we were so proud of that because it was the first Nature publication at that time from the institute that I was working with.
Bismillah ar-Rahman ar-Rahim. I'm pleased to be here at this high-level conference, and I'm pleased that Oman is organizing this and bringing us together to talk about a very important issue in order to mitigate and control AMR. I'm a researcher. I'm not a decision maker. And by the way, a chemist by training. So I'll talk a little bit more from what we have achieved at our own sector. We have established a research center under which we have 20 research labs. And perhaps what concerns this conference and this topic is the two labs. One is on drug discovery lab, and the other one, the medical microbiology lab. So in the medical microbiology lab, we have collaborated and worked together with the Ministry of Health, with the team of pioneering scientists during COVID-19 era. But we are continuing now on a project on antimicrobial resistance, and we've started this project about a month ago. So, and at the Drug Discovery Lab, we are working on 3 projects in collaboration with the chemistry department at Oxford University, trying to explore natural sources from here, whether the source is microorganisms, animals, plants mostly. And what we realized that very fascinating skeletons that we have produced now, and they showed high potency. So these, it's almost 2 years project of on drugs discovery. I have also submitted a proposal at the national level for a high throughput screening of Oman and plants and microorganisms, genetic resources, but that will also cover all synthetic compounds. What I'd like to add here, it's not enough actually to modify the existing generations of antimicrobial drugs, of antibiotics. If you take the 4th generation of beta-lactams, for example, then we need, of course, to have a new generation of these drugs. So is for macrolides. But what is even more important is also to keep discovering new plants. We need as well to find new diagnostic tools. This is very important. So this is at our own sector what we are doing. We have a bank now of medical fungi and medical bacteria in the center, and it is becoming the national bank in Oman. We have also a bank of around 1,000 therapeutic compounds with their spectral data classified according to their therapeutic potentials, and this can be accessible, so it can open a wide range of collaborations. At the national level now, again, I think the pioneering work done by the Ministry of Health, what we have witnessed, deserves really all commitments. If there is my comment, if we have an action plan, I think we should give it all elements of success. And one of those elements is funding. This is very important. I think I should stop here.
May I also take this opportunity to thank the organizers for having me here. I'm coming from the perspective of research and development, having worked in the area of antimicrobial resistance, especially with farmers and also with healthcare facilities in a truly One Health paradigm, because I work for a medical research institution. I would say what has been the most impactful way of addressing AMR from the perspective of a low and middle income country. I think we began from a point of view where our own policymakers would not believe AMR is a big issue. Why? Because they said, where is the data? We know malaria, we know TB, but we don't know about antimicrobial resistance. Actually, one journalist asked me a question. We have been shown a HIV patient, we have been shown a TB patient, a malaria patient. Can you show me an AMR patient? That's a very awkward question. It tells you people don't understand AMR. So I think it's very, very crucial that we have tools to be able to advise our own policymakers about the magnitude and the importance of AMR. And we are working with health economists to be able to look at what cost effectiveness means for addressing the issue of AMR. And one of the things that I've seen very, very impactful, especially with farmers, is to show them that they're not going to undergo losses by adopting less use of antimicrobials in their settings, because they're small-scale farmers. They're trying to fend for their families, to pay school fees. So they don't want to lose their animals, their day-old chickens, because they have been used all these many years to pump them with antibiotics from day one until when they sell them. If we can be able to demonstrate to them that you don't have to use antimicrobials, and still all your produce will go to market,
and you gain, we have seen in the Netherlands, you still get profit out of this farming. That's very, very crucial. I've seen that work in our settings. Secondly, I've also seen issues to do with stewardship work very well. And what some of the projects we've been doing is effectively working with school children, working with college-going students, and taking them through stewardship at their own level. And you'll be surprised at how impactful children are when they get back home and they say, no, you're not going to give me that medicine. We must see a doctor. We are told this is very wrong. We must see a doctor. And I also have seen a lot of use, especially within the government settings, of especially programs that surely demonstrate how effective we'll become if we are able to save dollars from importing expensive antibiotics. Save dollars if we're able to vaccinate our animals, and as well as, of course, take vaccines for prevention of disease. These are some of the imperatives that we must think about as countries, because that way we can be able to have a buy-in from the policymakers, because without the policymakers buying into this, we'll be then fighting a losing battle. Those are my initial comments. Thank you.
Thank you so much. I would like to start by expressing my gratitude and thanks to the World Health Organization and the Sultanate of Oman for inviting me to come over to this conference. It's such a pleasure, of course, to be here in Muscat for probably the 6th or 7th time. I feel like this is truly my second home, and it's fantastic to be in this great high-level conference, and I truly congratulate the government of Oman for putting this conference together. And I'm really hopeful that what's going to come out of this conference is truly going to impact our journey towards combating the antimicrobial resistance. And to address the first question to the panel, I think I would like to refer to one study and one theme. The first study is, of course, the study that was published earlier this year in February in Lancet, which has looked at the global burden of diseases. And it has clearly and eloquently addressed the topic of antimicrobial resistance within. Probably all of us would remember back in 2016 when AMR review with the work of Jim O'Neill, which I had the pleasure to serve on as an advisor, that report has actually estimated about 10 million people will die annually by the year 2050. That figure has astonished a lot in the political as well as on the medical community, because it is truly a huge burden. But let me take you back to the recent study that was published in Lancet, which has which has directly linked about 1.3 mortalities directly linked to AMR back in 2019, and has estimated about 5 million mortalities that are associated with antimicrobial resistance. To put this into context, we are basically 50% at what is speculated to be achieved in 2050. That is a huge figure. And you can imagine the world population. Now we are just reached to 8 billion people on the globe. You can really imagine the number of people that will be, of course, continue to grow on planet Earth by the year 2050. Yet, what is estimated in 30 years from now, we're already 50% there. So you can imagine the magnitude, and that potentially can address your concern in relation to the burden that antimicrobial resistance would impose on the local economies, not only on high-income countries, but also for sure on low and middle-income countries. The second topic I would like to address in terms of achievements that we have achieved in terms of combating antimicrobial resistance, as I told you, address themes, is of course the alternative therapies as well as point of cares. Alternative therapies, of course, we are so happy to see, for example, phage therapy and peptides being considered as potential solutions to combat antimicrobial resistance. And as a silver lining of COVID, we've truly touched and practiced firsthand how the point-of-care diagnostics can truly be powerful tools to tackle antimicrobial resistance. Yet, I think both achievements are really handcuffed by the rules and regulations we really need to jump through in order to make them available for public use. However, in order to avoid this, during the emergency of COVID, we developed, or we basically practiced what's known as emergency use authorization. Basically, we allowed ourselves as a human race to have a shortcut of all of the regulations in order to make these solutions available for patients. Why don't we do this with antimicrobial resistance? I think there's a huge need and demand to practice the emergency use authorization to make these solutions available for antimicrobial resistance. And to truly congratulate the UK government for practicing the innovation passport, which was announced by the former Prime Minister Boris Johnson, to make some of these solutions for medicines and alternatives for, to go through clinical trials. But I think we really need to practice that even broader with diagnostics as well. And
thank you, Dr. Hossam. Maria, it's your turn, please.
Thank you so much for sharing with us your thoughts and your experience. Now we'll go to a round of questions to our panelists, and afterwards we'll be going back to you, the participants, for questions and comments. And I will start with the panelists. To my left is Professor Joaquin Larsson. Professor, you refer to the complexity and the need to address CMR across sectors. You talk about your experience on the environment, and you refer to the pollution. I think it was an important part of how to address AMR, but also you refer what you are doing in terms of animal and in terms of human health also. And my question to you is, AMR is a complex phenomenon that needs to be addressed within and across sectors. What are important knowledge gaps still to be addressed where fundamental, applied, or implementation research within and across sector should be conducted? Not in link to your first question or your experience, whatever you want to share with us. Okay? Thank you.
Thank you. It's a very broad question. I like to see it as we have basically two options or two strategies to manage AMR, two paths that we need to walk at the same time. And one is to develop new antibiotics to match the pace of resistance development. And the other is to reduce the need for new antibiotics. And that, in turn, is done by reducing the overall number of infections and by limiting development and spread of resistance. So, all of us wants an easy fix. I would personally love a pill that makes me slim and fit and allows me to eat as much as I want to and not having to do any exercise. Wouldn't you like that? Same thing with infectious disease, right? You want a pill if you get sick. So we all tend to be very supportive when industry argues that we need to put more public resources in research to develop new antibiotics. The problem is that not a single new class of antibiotics that is broadly effective against gram-negative bacteria has reached the market in my lifetime, in over 50 years, not a single class. And that is not only because of ineffective business models that we talk about all the time. It seems to be genuinely difficult. And therefore, it is a high risk that the world will continue to fail this mission for decades to come, even with intensified efforts. With that, I don't argue that we should not invest in research to develop new drugs. I think we should. But I question if the allocation of resources between drug development, on one hand, and transmission control and antibiotic stewardship, on the other, has the right balance. I think we might need to put more into the latter. And industry will not be the ones that argues that. It needs to be the politicians and the scientists. So let's think again about the differences in resistance levels between countries. Differences are extreme, even within Europe. And all European countries basically have access to the very same antibiotics. So these vastly different burdens have nothing at all to do with success or failure in drug development. It has to do with differences in transmission control and antibiotic stewardship. So if research can help us do the right things with regards to those two aspects, I think the world would be far better off. And here, I think both environmental and social science components are vastly under-researched. So with regards to limiting the development, the emergence of new forms of resistance that happens all the time, we actually still don't know where these new forms of resistance emerges. In what types of environments do chromosomal immobile resistance genes gain the ability to move around and start their journey to pathogens and eventually cause disease? This might very well not be the microbiota of humans and domestic animals. And if it's not that, we might really misdirect our actions to delay the emergence of new forms of resistance. Maybe much of this happens in sewage. What do we do there? So we need more research on figuring that out. How does evolution take place and where, and what are the drivers? And with regards to the role of sanitation, I think we need to know much more about what levels of environmental exposure to different resistant bacteria that leads to colonization and to disease. What is the level of sanitation and hygiene that we need to reach to effectively mitigate AMR transmission? I mentioned briefly in the other panel discussion here that sewage surveillance might be a useful tool, particularly for regions with low resources to develop further. I think that's something we should look into. And with regards to social sciences and the humanities, I think we need to be humble and acknowledge that while underlying biological mechanisms for resistance development are all the same in all parts of the world, the ways to best manage drivers, such as antibiotic use or sanitation, will be very, very different. We need to acknowledge that we start on different levels, have different burdens of infectious disease, different resistance situations, different levels of resources, and not the least, different levels of trust in our institutions. And coming back to what I mentioned earlier, if we can find ways to incentivize change, and that's where social science comes into play. For example, through exposing the direct benefits of even one-sided actions in transmission control and antibiotic stewardship, I think we could make big leaps forward. Yes.
Okay, thank you very much. I think it was very clear to all of us. Let me move now to Dr. Joanna Kallio. Joanna, a part of being veterinary, she's a very good diplomat. I know her, she was a permanent representative of her country to FAO, and that since that time she was pushing FAO to work on AMR, including the animal part and the agriculture sectors, link also to environment. Thank you for that, Joanna. But Joanna, you referred the experience in your country where you have increased production without using antibiotics through good practices. We have also been referred by Professor Joaquin that we need more public resources in research and development of new antibiotics. But also we need to have more knowledge regarding the resistance, the evolution, where it takes place, where and when it takes place. And my question to you is, what are the most urgent solutions needed to address AMR, for which research and development can play an important role? And coming from a government, tell us, how should governments incentivize and implement them, especially where no tools are available for prioritization of investment and support the personalization of One Health national action plans for AMR, because it has been said that we need to prioritize. From your experience, okay, thank you.
Thank you very much, Marie-Hélène, also for your nice words. And as for Joachim, this is a very challenging question indeed. And I would like to start it by experience to say that normally the politicians and the decision makers pay attention after a crisis situation. And if there is not a crisis situation, it is much more difficult. And I think that we all know that in the food sector, unfortunately, we have had crisis situations, and we have had this COVID crisis where indeed we are all proud and happy that there have been investments on vaccination and on science. But on antimicrobial resistance, I think that when things are moving smoothly and the threat is somewhere in 2050, it's much more challenging to get the finances as we in the room and here in the podium would love to have. But I would like to have a very pragmatic approach again, to say that I think also for the policymakers it is the duty to take care that there's enough resources for the basic work and also for the development of the basic work. And there I go in the diagnostics. I think that we cannot have and we cannot guarantee, and I'm now concentrating in the veterinary and food sector, that we cannot guarantee the prudent use of antibiotics without a reliable and affordable diagnostic tool package. That's crystal clear to all of us, and there's always room for improvement. I'm sure that all the veterinarians in the audience, even younger than I am, have seen how things have evolved, and they should be evolving. There's no doubt about that. And then for surveillance, it's also a resource issue from the human resources, but also from the money point of view and from the development point of view. And listening very carefully to what Joachim just said about, for instance, about the sewage and the testing of AMR linked to that, my question and my own challenge is that how in the future we are able to do surveillance in the premises and in the farms. What is the right target to take the samples from? Not necessarily the animals in the future, but it is the environment and what kind of a technical package we have for that in the future. And that is something I would love to be involved in the future. There's no doubt about that. And then I told you, about my history on cultivating Salmonella and other bacteria, and then going step by step to molecular biology in the laboratory area. But today we are talking about the whole genome sequencing, and we are talking about the metagenomics. And the dream for all the doctors and the veterinarians is that you have a very rapid test to say, this is the diagnosis and this is the medication you need. But nowadays, unfortunately, still the cultivation, the very traditional one, is the fastest one. And that is a challenge that I think we have to put our efforts on. And I know that in different continents, people are concentrating on that. And my last wish for the future is, and that is coming to the most critical question and the most difficult one, Maria-Helena, from your side for the policymakers, is the use of impact assessment. Because we have to be able to explain the impact, what we are doing. And that is why we need to have the indicators that the policymakers understand. And we have to have the targets clearly on national level, on regional and on global level accepted. And that is a step forward also in the future, where we could have a much more systematic evaluation method for the impacts in the future. So perhaps this was a little bit a mixture of replies to the very complicated issue, but once more I want to repeat that the basic things have to be under control, but with the modern technology and with the tools perhaps none of us can really even dream of yet, but they will come.
Thank you, Jana. Good solution. Hopefully we have good number of policymakers here that they can take those solutions and weaknesses to be implemented. Prof. Ahmed will come back to you. You highlighted some good research finding, but let me take you now to the barriers and weaknesses that might face the sustainable value creation, production, and broad accesses for new therapeutic vaccine, safe and effective alternatives to antimicrobial diagnosis and the IBC measures, waste management tools in different sectors and at both national and international, and also the national action plan. So what are the most urgent, what are the main barriers and weaknesses in your mind, in your view?
Thank you very much, Dr. Hussein, again for this very important question. I'd like first to stress on the fact that was mentioned by Professor Joachim and Professor Joanna on the need to strike a balance on the resources and where to put the resources. I'll talk about drugs, maybe new innovation of drugs and the problems associated or the delay why we don't have innovative drugs. But it's important that I know many countries cannot go into that direction, especially in drug discovery. So it's very important to decide where the resources should go. On mitigating the disease, on finding new diagnostic tools. This is very important. Or again, to work on environmental transmissions. Wastewater management. Many countries, they don't have a proper water management systems, and that is one of the reasons behind the antimicrobial resistance. So this is very, very important, just to stress on what you've said before. Now coming to innovations in new drugs, this is limited to only certain countries. I mean, here in Middle East, this area is not practiced, unfortunately, and it has received less attention. I tried to persuade the several decision makers here to establish this facility for drug discovery. We have a huge diversity in Oman when it comes to natural products, when it comes to marine species, when it comes to microorganisms. But again, this was not on the top agenda, unfortunately. Having said that, this is also somehow pronounced everywhere, especially when it comes to new antibiotics. So there is, if you compare from 1900 to 1980, well, the infection rate has decreased a lot just because the antibiotics were working very well. So there are indications for the need of new drugs. But from 1980 to 2000, you know, the infection rate has almost doubled, which means, you know, strongly supports the fact of microbial resistance. So this is antimicrobial resistance. So this is one part of it. The other indication is that the innovation gap between generations of antibiotics and drugs is certainly huge and very pronounced. So again, from 1980 to 2000, when naldixic acid has been discovered and approved for use. So the innovation gap is also very huge, unfortunately. Thirdly, many big pharmaceutical industries tend not to fund, they are very hesitant to fund antibiotics, especially at the early stages of maybe phase 1 or phase 2, which makes it less attractive for researchers, academicians or academic researchers, to persuade this. There are other drugs that have received more attention recently, and perhaps they think this is it will produce quicker money for them, for sure. Finally, I'd like to stress on the funding, whether on the action plan or on innovation in drugs. So funding is an issue in many countries, and I think this is also clear here. We've faced a lot of constraints when it comes to funding, and we witness every year that this situation becomes even worsened. So this is in brief. I have a set of recommendations I have already forwarded to the moderator, and they will be available to everyone, hopefully, at the end of the conference.
Thank you, Prof. Ahmed. You have highlighted one very important pillar for research and development, which is funding. And some of our colleagues have also highlighted the need of new products like antimicrobial, for example. The question now is for Prof. Samuel Kariuki regarding the funding. Which policies and financial mechanism at national and international level can support, in your idea, research and development activities tailored to develop new and better products for solution for improving detection, prevention, and responses to the AMR? And I would like you also to highlight the cost and benefit of such solution and for various either public and or private stakeholders.
Thank you very much for that very detailed question. I think in terms of policies, we have, of course, the national policies that target response to antimicrobial resistance. And most of these actually have been developed in the last 10, 15 years since we started seeing AMR as a big issue, as a public health emergency. Then, of course, there are the international ones. But coming home, in terms of direct response, we must look at what policies exist in the agriculture sector. By agriculture meaning crops, livestock as well, and then what environmental policies exist, for example, in terms of even being able to control waste disposal. We just talked about how much waste determines antimicrobial resistance and transmission in our environments. We need to talk about also policies, other policies that target human medicine in general, and there are many, many of them here. In fact, a lot of policies on AMR were targeting human health rather than animal health and the other components of One Health. So in terms of policies, we are not short of them. I think the elephant in the room is the implementation of these policies. Do we have the willingness by our own governments to be able to implement this? And how can they be able to implement if really they do not sometimes see the cost of not implementing? I think we need to be able to show our policymakers that by not implementing these policies, and they are very well outlined in the now old global action plans, which were converted, of course, to national action plans, and the now revised action plans. They are very well detailed. And I think these objectives must be met with appropriate funding, because by not doing so, we should show our own governments the actual cost of not doing that and how that is going to impact on both public health, but also on food security, on our populations, because we'll not be able to adequately address that in the short term. We must also look at how best we must convince private sector to work together with government in a public-private partnership to be able to bring funds to R&D. We, especially from a low and middle-income country setting, we have a lot of problems or challenges trying to fund research locally. How can we be able to address that issue by being able to persuade private sector that by investing in IPC, infection prevention and control, by investing in biosecurity, you will gain much more in the long term by preserving antibiotics that you sell to us so that we don't lose them in the short term. How can we be able to work with those that are also in the private sector for them to see that by investing in new diagnostics, point of care diagnostics, and other tools that we can be able to utilize to be able to measure the cost effectiveness of implementing IPC and stewardship programs and so on. We must be able to have some very simple algorithms that we can utilize even at primary healthcare level, at the small-scale pharma level, for them to see in the long term, what are we gaining by implementing this? These are the tools we must be able to implement. We must be able to invest in them and invent them, because it's us to do it, and they may be different from one setting to another. I'm sure the way we do it in Kenya will be different from the way the Netherlands will do it, because our settings are different. We still grapple with the issue of proper sewage disposal. We need to start from there and see the cost benefits of implementing proper sewage disposal. I'm looking also at how we can utilize our health economists, our socio-anthropological experts in looking at behavior change. Some of these things I'm looking at in terms of being able to invest in them, to be able even to learn about behavior. Why do people buy antibiotics over the counter? Of course, traditionally, they'll give you many reasons, but how can we change the mindset of a father or a mother going to the chemist and buying antibiotics over the counter because they don't want to pay a small fee for investigation or for prescription and think that is a saving? But in the long term, how can we convince them that it's going to be more costly by not doing that? These are things we must invest monies in, and to me, I look at them as low-lying fruits. How can we be able to incentivize industry, especially private sector, to invest in new molecules and new, for example, vaccines? Because we want to prevent disease before it happens. That way we'll be able to bring down the burden of disease and therefore less need for treatment of both humans and animals. In the long term, of course, be able to avoid the issue of runaway antimicrobial resistance. And overall, I think most important is to be able to have some money in R&D that both at the level of the farmers and the human health, primary healthcare, especially where we don't have a lot of data, being able to have some demonstration projects where they see that things are working. And in my own settings, I think what drives motivation to action is for somebody to see that something is working with my neighbor. If it works with them, it will work with me. So we start from there and then go upwards. And then, of course, our policymakers must be convinced that we will put money in R&D because 5 years from now, we'll be able to save so many dollars. 10 years from now, we'll be able to save so many human lives. The politician does not want to hear that in their own 5-year term, they were unable to avoid deaths of young children because of antibiotic resistance. If you can be able to show them that during this time, unless you act, we will not elect you because we will have lost so many children. And it becomes that basic. I think we will have begun the war against the AMR. Thank you.
Yes, I was saying I'm moving again to the panelists seated at end, Dr. Hossan Zouawe. Doctor, in your first intervention, you referred to the burden in terms of cost of AMR to the global economy. It has also been said that we have all common challenge regarding AMR, but we need to have actions at national level in order to be able to really tackle AMR where it's happening, and also we cannot apply one size fits all. The countries are not at the same level. And our last speaker referred to the need of appropriate policies and the cost of inaction, I think is what it has been mentioned. My question to you now is, what is your experience in planning and conducting research activities to support implementation of the National Action Plan on AMR? We refer that we need a component of research in the National Action Plan, but also we need research to implement the National Action Plan. How you see this working?
Excellent. I think one of the most important privileges nowadays we have, of course we have the Global Action Plan and then we have our National Action Plans, are basically acting like compasses for researchers to go and develop their research according to those targets, according to those goals. And the research in this context truly has to be translational as well as implementing research. I will share with you a few stories, and some of them are really big to my heart and close to my heart because they brought me closer to colleagues who I always looked up for and on a GCC level. And I had the pleasure and privilege of working closely with them to put together the GCC network of looking at antimicrobial resistance. That work was really the milestone and the landmark for the discovery of several antimicrobial resistance pathogens in the region on a regional level, GCC level. I worked with a lot of amazing researchers and as well as clinicians on a GCC level. Some of them is Dr. Amin Al-Jardani here in Oman, and many others on a GCC level, where we collected samples from different GCC countries, looked at their antimicrobial resistance profile, and together collectively helped to paint a picture on the issue of antimicrobial resistance. The beauty of that work was really enlightening because it was cited in all of the national action plans that came after our work, and that demonstrated how that work was the center point of the national action plans that came after to address the challenges that we have addressed. So I think that is an example of how we can work collectively together in order to address a global challenge. Moving from that, I've also noticed the need for point-of-care surveillance, and that is and point-of-care diagnostics as well. On these two elements, I devoted my research to develop diagnostics that can truly help to expedite the diagnosis of antimicrobial resistance. And let me be honest a little bit with you. The research or the findings we had in terms of achievement for the point-of-care diagnostics, despite the fact they were really inspiring for us, they were a little bit disappointing when we see how we can translate those later on to be used on a clinical level. But COVID, the silver lining again of it, has really brought hope to us. We can literally capitalize on acts such as the emergency use authorization, potentially, to translate these research for use or research only use products to can potentially be utilized for clinical diagnostic. And I'm really hopeful where we can utilize this platform to advocate for that. And of course, by working on this sector, which is point prevalence work or surveillance, if you want to call it, as well as diagnostics, I realized the importance of being vocal, being out there, trying to advocate for antimicrobial resistance. And that, where I stepped into the social science work of antimicrobial resistance, trying to advocate for AMR on not only media level, public level, and so on. So in order to do so, I got into filmmaking, for example, where we developed a documentary which has won the Saudi Film Festival Award for the best documentary in 2019. Not only so I not only walking on red carpets, I actually, that has made it to cinemas as well as on a Netflix-like platform here, known in the Middle East as Shahid TV. So now you can watch it if you have access to Shahid. It's called The Cave, where we demonstrated the issue of antimicrobial resistance in a very interesting way by going and discovering caves in different parts of the world. And that in that documentary was in Dolomito, or Dolomites Mountain in Italy, to demonstrate the need for discovering new antibiotics and so on. And we later on published some work of that. But let me tell you a secret of why I went through that channel. The truth is, that was a funding opportunity for filmmaking, which we leveraged in order to help our research. So we researchers are truly smart to tackle different funding opportunities, to tailor them to help our research. And I don't think this should be the case. I think funding truly should be available to address the different research challenges we are doing. And I'm going even further on that, where I'm using my hobby, which is sport, to advocate and raise awareness and funding for antimicrobial resistance. So I play with a polo team named the Superbug Slayers polo team. I mean, I know it received a lot of laughs, but that has helped a lot to go in different sport venues and talk with the best players around the world about the issue of antimicrobial resistance, and hopefully we can get their engagement to help us to tackle this global challenge. Thank you.
Thank you. I liked very much how you use all the tools to raise awareness, from the red carpet, from the sport, from your knowledge as scientists. This is really what we need to do to raise awareness and to tackle this multitude of this interconnectedness of AMR. Now, ladies and gentlemen, let me thank to the panelists for their insights. I think it has been a very interesting panel. Now, let me go to the audience. Please ask any question you may have to the panel or any comment. I would like to ask you to raise your hand and try to be brief. You have 15 minutes, I think 15, 20 minutes maximum. And well, at the end of your question, say if you want a given one of the colleagues here in the panel, or is it open to us as moderators to decide who will reply. Please.
Thank you very much, panelists and co-moderators. Nyebuchi Chukwu is my name, from Nigeria, and also a member of the Global Leaders Group. I'm just asking, it could go to Professor Joachim Lassen, or it could go to any of the panelists. Is there any way we can really research into the cost effectiveness of the different kinds of interventions, either intervention in terms of prevention or intervention in terms of cure? Because I just saw that was a big enigma. What do we do? When you have real emergencies like we had during the COVID, everybody's just looking for that pill that will get the work done. It's someone that you can't just be preaching about. You should have washed your hands. You should have. No, it's okay. First, I will apologize, but can you save my life? So is there something we can use to decide so I can prioritize? Thank you.
Thank you. Let me cluster one or two more questions, and then I give the floor to the panelists. You have two at the end. Our friend from South Africa, followed by Tanawat.
Thank you. Thank you very much. Thank you to the panelists for their insightful deliberations. My name is Mike Mudisani from South Africa. I'm a veterinarian prof. It's very difficult to ask professors questions. But coming from a practical point of view, I'll just maybe indicate that I once visited one country in a conference and then realized that there were, in the posters outside, they were advertising that they are still using colistin for animal health purposes and things like that. We asked questions as to why and things like that. But the one question that came out very clearly, especially from the pharmaceuticals and then also from the producers, was, now if you say I mustn't use some of these antimicrobials, how are you going to compensate me for the little bit more weight gains I would have made in my animals and so on, and who's going to compensate for that loss? So maybe from that point of view, if you could maybe share your experiences on how can we compensate for these losses, because for us to make a policy, we obviously have to consult our producers and then get them to buy in into what we are trying to achieve. My question is not directed to anyone per se, but maybe any one of the panelists who could assist with the response. Thank you very much.
Thank you. Tanawat?
Thank you very much. My name is Tanawat Tiansin, Directors of Animal Production and Health at FAO, and also thank you our moderators and panelists for your insightful information. Actually, I discussed with colleagues from South Africa what we're going to ask our panelists, our professor, which is actually one of the issues when we're talking about research. We want to have more operationalized research that our producers, our farmers can use it immediately. For example, I think it's a good example in Finland when they started using probiotics or any other feed additive, because we know that to develop the new products is not easy. But anyway, in the meantime, we also have to make sure that our producers, whatever aquatic animals, terrestrial animals, our producers can use those alternative solutions, and that's why we need practical solution and options that we can support our producers, and also to make sure that we also can support our public health as well. Thank you very much.
Thank you, Tanawat. We have one question addressed to Professor Joaquin. They are open. I will then ask any member of the panel who want to address the two questions. Professor, over to you.
Yes, so it was the question about calculating cost benefits. I think you all know about the Stern report and the role the Stern report had for climate change, basically putting a price tag of inaction with regards to not doing anything against climate change. That was a super important driver for action on that side. I think we do need to work on actually showing the costs of inaction and the benefits of actions. You can do it in different ways. Sometimes you can actually do controlled experiments or semi-controlled experiments with certain types of interventions. For example, I've seen studies that the intervention that pays off the most in hospitals is hand washing. If you start from a low level, it's really the thing that pays off the most, because it can really bring down infection rates if you go from no hand washing to hand washing. So, and you could of course do more correlative studies, but they need to be backed up also by other studies. So I think it's possible in many ways. If you look at measures that direct emergence of resistance, though, compared to transmission of resistance, I think it's challenging, because emergence are things that happens can happen once on one time of the planet, and the consequence might be immense. Let's say NDM never developed. We would have been better off, but now it happened. Or MCR or other genes, right, that emerged. So those things are really, really difficult. So maybe we can just calculate what was the cost of NDM? What was the cost of this? And then we could think about how much could we invest in trying to reduce the emergence of one resistance factor. Yeah.
Thank you to the gentleman for the very good questions. I was already referring a little bit on that in my opening talk, but I will come back to that. Of course, one thing is that you can have legislation. I'm a legislative person, so we can force people to do something. But by this age, if you allow me to say so, sometimes the legislation is not the best solution. But it is the advice giving and that the farmers are jealous to each other. Because of course, when you change something in the management system, in the beginning it might seem that everything goes wrong. But then, depending on whatever husbandry you are dealing with, how much time it takes to improve. But if you gain more meat, if you gain, for instance, more piglets alive, that is the best, advertiser you can have. Money talks here as well. So advice giving, benchmarking, advice on professional level and from farmers to farmers. And also the veterinarians play, in my opinion, a very crucial role in that. And I can say one example from the animal welfare point of view, which is a hot topic in Europe and my country. It's about free farrowing of sows. Very negative approach in the beginning by the farmers. But then when the first one started, and they realized that indeed the gain is much better. Now it's overwhelming. It's very easy now to go to the legislative part and make that obligatory. So that is a fascinating thing, but indeed in the beginning, extra work, there's no doubt about that. But it is also for you gentlemen, the veterinary practitioners to tell, it's worthwhile doing.
Thank you. That's actually a very important discussion, and I truly, it touches my heart because I sit on the WHO on the advisory group for critically important antimicrobials, and I personally believe that we truly need to preserve those antimicrobials regardless for human use. It's that kind of discussion, I think, has to be dynamic, and it should address the fact that these medicines are important and as important as anything else that will save our lives. The discussion of how you're going to compensate me for the weight I would have lost if I stop using antibiotics, it's the same discussion we should address, if so, on how to compensate for the time wasted by not driving so fast. It's basically the weight you gained by using those antibiotics is illegal or should be illegal at the first place. And then we should talk about how we can make sure that you still is there gaining profit, being in the present as a business, and sustainably without jeopardizing the existence of antibiotics. I think this is the most important discussion we should address. Thank you.
Thank you. Professor Ahmed or Professor Samuel, any comments? Okay, over to you.
Yes, thank you very much. I would like to comment regarding the concern on practical tools that can actually be applied, say for our small-scale farmers, especially because I'm saying that group is among those that utilize a lot of antibiotics because they put a lot of chickens in a very, very small space and they're trying to feed their families. Very good cause. How can we practically help them? I think this is a big, big issue. Let's look at when we call a congregation and we preach to them and now nobody is getting converted, what is the message here? Maybe we need to change the way we communicate to these small-scale farmers, to these parents with young children in the rural areas who have to go to the chemist and get antibiotics because their child is coughing, but they don't have money to go and see a specialist. So I think communication here needs to change. The way we have been communicating in a manner that probably is not sending the right message, that we just bring policies and trying to implement them to people who probably don't understand and don't own the problem. We must start first by knowing that the people we are talking to own the problem and they understand that by doing the right thing, they are not going to incur losses. But instead, they will have a new paradigm. They will have a new methods of being able to grow their crops or being able to raise the animals without necessarily using the antimicrobials. They have an alternative. And it has been demonstrated using their neighbors and other people in these settings that it can actually work. Change is very, very difficult to adopt. Behavior is even more difficult. And it takes time. But we cannot give up. We must persist.
Okay, thank you. And okay, thank you so much. I think it was a very interesting discussion, lively discussion. We receive a lot of inputs to what we have discussed. Now I give the floor to my colleague to summarize the discussion we have had today.
Thank you, Maria. Yes, it was a very rich discussion. The session was about research and development. We had actually 3 academicians and 2 decision makers, although they are also coming from a research background. But this is a very clear indication that it's mainly relying on their shoulders, because what I have noticed that one very important gap, let me say, in research and development is funding. So financial commitment, our colleagues in the next room, they are talking about political and financial commitment. So hopefully they are coming with some good recommendation to improve the research and development. I would maybe highlight some important points that's been raised. One of my colleagues in the previous sessions said that science is lacking behind. It might be true, but we have to admit that we have intensive literatures and enough data that it need maybe to be shared, communicated well between the countries, between the private and public sectors as well also. We need, I always say that international collaboration between researchers sometimes will reduce the limitation of financial funding, because sometimes you have money and you can make more out of it if you work with your colleagues from here and there, from one country to another. So we need a partnership and collaboration between researchers and between the government, within the countries, between between private sectors and public sector. Those are very important. Regarding the policies, policies are there, but it was very clear that implementation is lacking. So implementation is more important than the policies itself. We need awareness to all of the stakeholders on the proper use of antibiotic, for example. We need a proper management to pollution, for example, waste management as a source of problems, sources. Precautionary approaches was also highlighted, and we need it in prevention, vaccination, for example, and for the hygiene system related to the production as well also. There is a lot of things that need to be raised in the R&D sections. And we are all relying on you, researchers, and on the decision makers, policy makers, to clear the way and to support all researchers to produce a fruitful things at the end of the day. And at the end of the day, I would like to thank the panelists, all of them. Thank you for traveling all the way to Sultanate of Oman, and thank you for my co-moderator, for the reporters, and for all you, our distinguished visitors to the Sultanate of Oman. And thank you for sitting until this time and contributing to the question and answer session. Thank you again, thank you all. Wishing you all the best.